Good afternoon, class. This is Group 1, and I'll be presenting respiratory discomforts during pregnancy. The group members include Cheyenne Bovell, Jamil Jones, Kayla McLean, Joseph Sandy, and myself, J. Nicholas. The respiratory discomforts we'll be introducing today is shortness of breath, nasal congestion, increased respiratory rate, acid reflux, and rib pain. Introduction. Pregnancy is both a miraculous and uncomfortable experience for expectant mothers. This journey is commenced by numerous changes and adaptations within the female body. While most days of pregnancy are spent in the happiness of buying tiny clothes and anxiously awaiting the tiny human's arrival, other days are spent in discomfort because of the physiological changes during pregnancy. Respiratory discomfort is one of the many aches and pains expecting mothers experience during pregnancy. Complications that come along with respiratory discomfort are shortness of breath, nasal congestion, increased respiratory rate, acid reflux, and rib pain. Shortness of breath, clinically referred to as dyspnea, is one of the most commonly talked about respiratory discomfort during pregnancy. Dyspnea is commonly reported by 70% of healthy pregnant women starting from the very first trimester of gestation. The respiratory system undergoes crucial changes to meet the decreasing demands of oxygen for the pregnant female, as well as her unborn baby. During pregnancy, women experience elevated hormone levels such as progesterone levels, which acts as a respiratory stimulant that increases tidal volume and minute ventilation. Although these adjustments are necessary for the growth and development of the fetus, they can result in sensations of breathlessness for the pregnant female. The uterus expands as the fetus grows, exerting additional pressure to the diaphragm and likewise reducing the lung capacity to expand to its full potential, causing the pregnant individual to have difficulty breathing, which results in shortness of breath. I will now pass you on to my colleague.
Nasal congestion. Nasal congestion, also known as pregnancy congestion, sometimes referred to as rhinitis of pregnancy, is an inflammation of the nasal mucous membrane that results in stuffiness or congestion during pregnancy. It lasts for a minimum of 6 weeks and is not associated with any infection or allergy. Sneezing, postnasal drip, runny nose, and congestion are among the symptoms. Nasal congestion brought on by pregnancy can harm the fetus and lower the quality of life for expectant mothers. Although the exact etiology of pregnancy-induced nose symptoms is known, it is believed to be related to the overall hypervascular and hypermetabolic condition associated with pregnancy, as well as fluctuations in hormone levels, including those of progesterone and estrogen. Birth control pill use has also been linked to reports of non-allergenic retinal symptoms. I now pass you on to my colleague.
Next, we have increased respiratory rate. During pregnancy, the respiratory rate remains relatively consistent, although minute ventilation, which is called VE, increases dramatically, up to 48%, due to increased tidal volume VT, with an unchanged respiratory rate. This ventilatory pattern is maintained throughout pregnancy, and it is mostly achieved by improved rib cage displacement, while the diaphragm position remains unchanged. The rise in VT during pregnancy is mostly due to physiological changes in hormonal patterns, particularly the steady increase in progesterone, which acts as a trigger for the primary respiratory center by increasing its sensitivity to carbon dioxide. This causes an increase in both ventilatory and inspiratory drives. As a result of these changes, the respiratory system consumes and ventilates more oxygen, while lung volumes fluctuate significantly, with a decrease in expiratory reserve volume (ERV) and functional residual capacity (FRC, and an increase in inspiratory capacity. These changes can cause shortness of breath or trouble breathing in many pregnant women, particularly as the pregnancy continues. I will now pass you on to my colleague.
Acid reflux or heartburn is common during pregnancy, and up to 45% of women experience acid reflux. Symptoms include, but are not limited to, burning in the chest, bloated stomach, burping, strong acidic tastes that come up with or without nausea and vomiting. The reasons for an onset of heartburn during pregnancy can be closely tied to a multitude of reasons. I now pass you on to my colleague.
Rib pain. Lastly, pain in and around the ribs, whether it's a dull ache, sharp pain, or just a feeling of tenderness, is common in pregnancy. Right rib pain is more of a concern than left rib pain, but any severe pain should be evaluated by your doctor. The ribs take up a sizable space in your thoracic body. Rib pain during pregnancy can be used by a number. Rib pain during pregnancy can be caused by a number of issues. Not all rib pain actually comes from stress on the ribs. If you're experiencing rib pain or shortness of breath, it may help to sleep on a slight incline made by pillows or a sleeping wedge. If you sleep on your side, put a pillow between your knees. In the second and third trimesters, try to sleep on your left side. This will reduce pressure on your liver and improve your circulation. Further, left rib pain and right rib pain may point to different issues. Some pains may be serious. Here are some of the most common causes of rib pain during pregnancy. Musculoskeletal changes, fetal positions, hormonal changes, ectopic pregnancy, and preeclampsia. There are several ways to erase rib pain at any time during pregnancy and to avoid it in the first place. Some of these ways are exercising, reducing inflammation, getting a massage, watching your weight gain, and taking a analgesic. I'll now pass you on to my colleague.
In conclusion, respiratory discomfort during pregnancy, such as shortness of breath, nasal congestion, increased respiratory rate, and acid reflux, and rib pain are common yet complex phenomena. The pregnant woman and their healthcare provider should warrant consideration and management of these discomforts. Throughout the pregnancy term, expectant mothers undergo a series of physiological changes to support the growing fetus. Thank you all for watching. These are our references, and I'll pass you on to the other group. Any questions?